We are back here on Carolina Women. I think we need to take a field trip. Let's go talk to Brad Morris about your health and wellness, and then come back here to Birdie James on Carolina Women. Welcome back to Carolina Women. We are here with our friend Dr. Bradley Morris. We are at Integra Vita and excited to be here today. You know, I had a few minutes before we actually started to just sort of look around and peruse and check out some of the things that I didn't realize you did. And one of the things I noticed was medical ozone. It's fascinating to me. And you were giving me a bit of the history, but talk to me about medical ozone and ultraviolet light and some of the new things that you're doing, because they sound amazing.
Well, ozone and ultraviolet light have been around since like 1930s, so It's not really new technology. It was big in the United States really until the invent of vaccines and antibiotics, but in Europe it continued to grow, and there's thousands of practitioners in Europe using ozone and ultraviolet light. I don't know how many years ago exactly it's been when they decided to marry the two, and by marrying them, they just made it that much more powerful. And so what it does, it's going to really clean your blood. So we call it super blood. Okay. So then when we do an IV, we're going to run that back into you through that ultraviolet light, and that will help clean your blood.
So who is a candidate for this treatment, number one? And then how often does a person need to have the treatment to supersize their blood?
Well, I actually do it just because I want, immune health, everything that we have going on out right there.
Almost a prophylactic immunity.
Yes.
Okay.
But
sense.
People that are sick, people that have bacteria, viruses, fungus, molds, Lyme disease is a really big one that ozone ultraviolet light really attacks and gets rid of. So you can make people feel better with that. So, as far as what does it treat?
Yeah.
It's, you can go down the disease list. Because a lot of things are related to having a decreased immune system. Okay. And what this is doing is boosting your immune system.
Okay, it's boosting.
Yeah.
What is ozone?
Ozone is O3, so we're all used to O2, which is oxygen.
Yes.
And what that is, it's oxygen with the free radical. And so what ozone does is it causes chaos. Okay, and anytime you create chaos, the body's coming to its defense to try to heal it.
Okay, that makes sense.
Yeah, so when we do these treatments, we're actually going to mix the ozone with the blood when it's outside of your body. Therefore, it's going to go in there and clean everything up. A lot of people use ozone, and we do as well, to disinfect and kill smells. So ozone's wonderful for many things, except your lungs.
Yeah, well, you said because of the oxygen.
Yeah, you can't.
Are there ozone
it.
machines that actually purify air?
There are. Yes, we have one. Of course, you can't be in the room, so you let it run, and then you wait about an hour after it's done running before you come in and open up the doors. They've used it a lot with fires, molds, that mildew smell.
That kind of thing. Mm-hmm. So how often does a person need to have an ultraviolet ozone treatment?
Well, with Lyme disease, one of the problems they have is called Herxheimer's. And, in the beginning, we feel bad because you really don't want to make people feel bad, but they were having these bad feelings anyway. So we will do them back to back to back as often as possible. Right. Some of the other things that aren't quite as severe, you may do it 2 to 3 times a week.
Oh my gosh, for an extended period of time.
Yeah, and we kind of do it in batches and go, okay, let's do these. And we're evaluating them every time we see them and see how they're doing.
Is IV treatment, I don't want to say popular, but helpful these days that we know more and more about IV treatments?
Yeah, it's becoming very popular. And the reason I think it's becoming so popular is everyone's digestive tract is a mess. Mm-hmm. We see it here every day, and therefore they can't break down things properly, therefore they can't absorb them properly. So by doing IVs, now you're getting to skip all of these things where you got to absorb it. So it goes right into your bloodstream so that you can actually use the vitamins that you're taking.
I was going to say, are some of the treatments that you do vitamin related? What are some popular ones or really impactful?
Probably the strongest one we do is called NAD, nicotinamide adenine dinucleotide. We just call it NAD because that's a long word. Yeah. But what that does is that's going to repair mitochondria. And it's a B3 derivative, so it's a B vitamin derivative. And we, along with that, will give you what's called a fast vitamin IV. And that's loaded with magnesium, B vitamins, enzymes, and amino acids. And I do those once a week just because.
Does it give you energy?
Absolutely.
Does it make you feel good?
It really does.
I know, you had mentioned that once before, and I went home and did a little research on it. It said that it can really kind of rejuvenate.
Yeah, well, your body's made of cells.
Okay.
right? And the mitochondria is the battery to all of your cells. So if we can repair that mitochondria, then we are, in essence, anti-aging.
I told you, I saw a picture of you from 2014, I think it was.
Yep.
You look, honestly, 15, 20 years younger.
Thank you.
And no, but I think you're in such good shape now, and I think that's a testimonial to what you're doing here.
I keep getting older, so I'm like, I got to anti-age now.
This is a good
So
thing.
yeah, I'm spending a lot of time and energy at anti-aging going, all right, what's the latest and the greatest?
Well, I appreciate you joining us. It is always fun. I learn something every single time I'm here, so I appreciate it. Stay with us. There's more to come here on Carolina Women.